HIV to decrease HIV prevalence among the IDU population by northeastern states. Project Sunlight due to health awareness, free distribution of disposable syringes. The route with maximum risk of transmission is IV blood transfusion, that is 90 to 92% risk of having the HIV. Vertical transmission 20 to 25%. 25% if breastfeeding, 20% if not breastfeeding. Then anal sex and IV drug users. Then most commonly route of transmission is a vertical transmission and unprotected sexual intercourse. There is integrated biological and behavior surveillance. It tells about the high risk group for the HIV. The best is HIV sentinel surveillance in that there is active is malaria, and passive is TB. HIV sentinel surveillance tells about the trend of HIV and impact of HIV programs. There are high risk group for HIV. In high risk, there is sex workers, IV drug users, transgenders, and male having sex with the male. And in bridge population like truck drivers and migratory workers, these high risk and bridge population are known as active. Then in ANC mothers, these are passive, and that is opt out testing. In 5 compulsory test malaria, in ANC mothers we have to do 5 compulsory tests like malaria, VDRL test for syphilis, HIV, hepatitis B, and hepatitis C. 2 consecutive ELISA tests done anonymously by taking drop of blood. If both 2 ELISA positive, then HIV positive. Then we have to categorize the persons like high prevalence state criteria having HIV in HRG more than 5% and HIV in ANC more than 1%. In moderate prevalence state, HIV in HRG more than 5% and but HIV in ANC is less than 1%. Low prevalence states are HIV in HRG less than 5% and in ANC less than 1%, but with known hot spots. Like for two treatment, how to treat, we give the antiretroviral therapy to a patient, no cut of CD4 count to start ART. We use tenofovir, efavirenz, lamivudine lifelong. Then ART plus center having facilities, second third generation ART, CD4 count, and third generation ART. Second one is ART center at district hospital. Then third one is link ART center, that is at CHC. For what to do after post exposure prophylaxis, start taking ART within 24 hour, maximum 72 hour. Then continue ART for 28 days. Then first test after the 3 month. If test is positive, then ART we have to continue ART for lifelong. If a test is negative after first test after 3 months, the test is negative, that is confirmatory test. If confirmatory test is for 6 months negative, if positive, then we continue same ART lifelong. If confirmatory test 6 month is negative. So that's all about the HIV. One more thing is the prevention, PPTCT means prevention of parent to child transmission, that ART started even from first trimester and given lifelong. Then we can also start syrup nevirapine 2 milligram per kg per day within 24 hour, give till 6 weeks, zidovudine after 6 weeks. First test of kid at 3 months is, if a test is positive, then we continue ART. If negative, then confirmatory test at 6 months. Then confirmatory test is positive, then again we start the ART. Exclusive breastfeeding for 6 months. No water, no top milk, no pre-lactal fluid, no compensatory feeding, like abrupt stopping of breastfeeding at 6 months. So that's all about the HIV.